Many women are navigating their pregnancies during a pandemic, and now some advocacy groups worry about the implications for maternal health. KXAN Investigator Arezow Doost reports on why some moms are turning to home births.
I had a seizure that caused a brain hemorrhage. I was in the ICU. I had to have an emergency C-section.
That was 3.5 years ago. Haley Rose had her baby boy 10 weeks early.
And it was so stressful. So stressful. And I didn't have to wear a mask, and I could see my physician's faces, and I could read body language.
She's getting ready to give birth again in just a few weeks. Haley is part of Circle Up, United Methodist Women for Moms, which advocates for maternal health. The organization worries women are missing prenatal checkups and need more access to telehealth.
You can't take a loved one or a child with you to your appointment, so juggling to get to that appointment becomes harder. Practitioners are reducing the types of appointments that they offer in order to minimize exposure.
We're doing a lot of Zoom appointments with clients. They're doing a lot of their checks on their own, like they're taking their blood pressure, they're listening to their baby's heart.
Denise Washington is a doula with Mama Sana Vibrant Woman.
I am there to speak up for them and also be another voice for them. And that's being taken away because most of the time now I haven't been in a birth room as a doula since early March.
That's because hospitals now only allow one person in the delivery room. Washington says that's pushing more women towards home births and more uncertainty.
Just because you plan for a home birth does not mean that you will have a home birth, because things can happen during labor and delivery to where we may need to transfer you to the hospital.
As organizations work to advocate, moms like Haley say they're speaking up for themselves.
I might not be here today if somebody hadn't helped me notice a condition that could be dangerous.
Arezow Doost, KXAN Investigates.
Researchers at the National Institutes of Health are studying the impact of COVID-19 during and after pregnancy. They're looking at medical records to see if changes put in place as a result of the pandemic led to higher rates of pregnancy-related complications and C-sections. A Texas lawmaker is interested in that too. State Representative Sean Theory says that she's part of a group that just sent a letter to the Texas Hospital Association asking the state to allow doulas and delivery rooms.
We just don't have enough information. And what we do know is alarming. African American women, as you know, were already at increased risk for maternal morbidities and mortalities. Now we're finding that African Americans are now at 3 times as high of a mortality rate from COVID-19. So that's something that has to be addressed.
And she's asked Governor Greg Abbott to establish an emergency task force to focus on how COVID-19 is affecting the African American community. KXAN's investigative team discovered problems with how Texas tracks maternal deaths and near deaths and the solutions that are still being explored. Watch the Mothers Erased investigation on KXAN.com.